Hey guys, Dr. Daliah here. Hey, I'm here to teach you diabetes in under 5 minutes. Now, of course, I can't do it justice. I mean, this took me years in medical school and I'm still learning about diabetes. But many of you have trouble understanding the concept of diabetes and you have difficulty explaining it to family members. So hope this little 5-minute tutorial makes it really easy to comprehend. And I need to credit one of the nurses that taught me about this in medical school. It was a nursing diabetic teaching program, a nutritional program that taught me to look at diabetes like an office, where you have the waiting room as the mouth, you have the hallway as your blood vessel, and then you have the rooms in the office or the clinic as the cells of the body. So mouth, blood vessel, cells, or waiting room, hallway, rooms by the hallway, okay? Now, diabetes means you have high blood sugar in the body. So your blood sugar comes from food. This food gets broken down in the mouth, broken down more in the stomach, absorbed in the small intestine, and you got this organ near the small intestine called the pancreas. And the pancreas's job is to shoot out insulin. Now, what's insulin's job? Insulin's job is to take the blood sugar that is now floating around the blood vessels and get this blood sugar into the cells. I call it a key. It's the key to the door of these cells. If the blood sugar doesn't get from the blood vessel into the cells or from the hallway into the rooms, you can starve. Sugar feeds the cells, which is why sugar is still so imperative. We just don't want you to have too much. Now, an example of somebody that doesn't have this process working correctly are your diabetics. You got a type 1 diabetic and a type 2 diabetic. Type 1 diabetic, usually we diagnose as kids because they get very skinny and they don't grow. Why? The blood sugar stays in the blood system. It doesn't go into the cells like it's supposed to. The person doesn't get fed and unfortunately becomes very skinny. We have to give them insulin to get this sugar into the cells because that's the key. Type 2 diabetics obviously lived long enough to adulthood, but they tend to be more obese until we diagnose them with diabetes. When we diagnose them with diabetes, they start to have weight loss. So type 2 diabetics are interesting. They obviously have insulin because otherwise they wouldn't have lived long enough to make it to an adult. However, either they aren't making enough insulin, maybe there's just less levels, or this key is a little rusty and it's not working too well, or the key's fine, you have enough insulin, you have enough keys, but the door won't open because there's something pushing against the door. Well, that I like to call insulin resistance. So, with diabetes, if you don't get this sugar into the cell, one issue you have is weight loss, right? But you could have other things happen to you. I really can't spell. That's weight loss. All right, you know what that is. All right? Another thing that could happen to you is you could go blind. Why would you go blind if you have diabetes? Well, in nature, and for those of us who remember back from our biology classes, in nature, things want to be neutral, okay? Not politically neutral, just neutral in general. So if something is sugary or something is salty, your body is going to want to draw in fluid to neutralize how sugary this is. So how does your body bring in fluid? It makes you thirsty. You get thirsty, so you want to bring in fluid. Now, don't be drinking like lemonade, but you're going to be drinking fluid because you want to dilute this. Well, let's take a look at the little baby vessels of the eye. How much fluid could these little baby vessels take in before they start to rupture? That's one cause of diabetic retinopathy. Plus, when it comes to your kidneys and when it comes to the nerves, if you have all this blood sugar in the blood vessel, how healthy is that blood vessel? How healthy is the wall? Are you getting plaquing? Are you getting sticky, sugary substances? The good things in your body can't get to where it needs to go if you start clogging up because of the sugar and these plaques. And what else seems to get clogged? That's right, your heart. The arteries to your heart can get clogged. So it's imperative that we get the sugar out of the bloodstream and into the cell. Well, there's a few ways to do that. One is, let's have less sugar get into your mouth. So what we recommend is we eat less sugar. Another thing we want to do is lower your weight. If we reduce the insulin resistance so these doors open up, now the sugar gets from the hallway into the cell. Another thing that really helps prevent diabetes is exercise. Exercise lubricates this key so it works better. And we find you burn more sugar and your insulin works better if you exercise. So this is diabetes in under 5 minutes. Hope it helps. Bye.